I'm just reminded of Miss Priyanka Chopra's words, women should be financially independent. So let's get started. Let's first learn the maternity benefit laws in India. So according to the Maternity Benefit Act in India, a woman is entitled to about 26 weeks of paid maternity leave. Now this was initially 12 weeks, and in the last couple of years they have extended it to about 26 weeks. When can a woman actually take this leave? So this can be availed from 6 weeks towards your date of delivery, your expected date of delivery. For example, you should take it like 6 weeks before your expected date of delivery. You could extend it for about 6 months after your delivery. So as a mom, I feel it's wise to extend this leave. You could push it as much as you can towards your date of delivery, so you get more time to spend with your child. For example, if you take it like a week before your delivery, you would probably have a lot more time to breastfeed and bond with your child. Now this holds good for any organization which has more than 50 employees. Next, as a breastfeeding mom, you should know your breastfeeding rights. So in any organization which has more than 10 employees, the employer is entitled to give you 3 to 4 breastfeeding breaks, each for about 15 to 20 minutes. And they ideally should have a daycare center or a nursing or a creche somewhere close to the hospital, say within 500 meters from the hospital or from the organization. Now getting into a routine. This is important not just for you but also for your baby. The baby is a newborn, so it is much easier for the child to adapt to a routine. Now getting into a routine, you should begin at least a couple of weeks before you get back to work. So if you're going to be joining work like in 2 days and then you start getting into a routine, now it's not going to help you. There's going to be a lot of confusion. So always plan your schedule and get into a routine. And command your space. Now like I said, any organization which has more than 10 employees should provide a private non-bathroom space for breastfeeding. Like Ms. Aditya just mentioned that she had to literally run behind the factory space and breastfeed. That is not done. I have seen in many hospitals women breastfeeding in bathrooms. Again, you know, it's disgusting, I'm sorry to say that, but yes. So try to ask them for a private non-bathroom space in any organization which has more than 10 employees. Now embrace flexibility. Now this is a world where we do a lot of things online. So today we have a lot of listeners, a lot of breastfeeding moms listening to us online. So if there is an option of work from home, then you could resort to it. And see, in an IT field, they expect you to work, they expect the lady to work only 40 hours a day. So rather than working 8 hours a day, you could probably take like 10 hours or 12 hours a day. So you get like a non-pumping free day wherein you can directly breastfeed your child. So this is going to help to sustain the secretion of milk. So if you do not have the possibility of directly breastfeeding your child at work, you will have to pump. So there are two methods, manual breast pump and the electric breast pump, the details of which Sonali is going to be talking about. So again, hand expressing is the traditional method wherein you use your 4 fingers, make a C with your 4 fingers and your thumb, put it around your nipple areola complex and try to contract and relax it, try to hand express the milk. It is very important that you label the milk parts, the pumped milk. So why this is important is, for example, you start your work at say 9 o'clock in the morning and you pump at 11 o'clock. Now again you would probably be pumping at 2:33 and another pump maybe at 5 o'clock. So when you do this, you should give the milk, you should probably once you get back home, try and give the milk that is pumped earlier. If you do not label that, this is a very small thing, but then I insist on this because otherwise, you would be, your milk might get wasted, and trust me, every drop of milk counts. It's liquid gold, like what ma'am said, Dr. Priya. It's important to also refrigerate between pumpings, and this has to be a clean refrigerator. Once you refrigerate, when you get back home, you'll have to warm it between your hands and then use it. Some people warm it in lukewarm water, and breastfeed the child. That is again okay. Now when you're at work, when you have to pump the milk, focus on your baby. Do not think about anything else. You could probably carry a picture of your baby to your workplace, look at the baby, because we've seen a lot of women when they speak about their baby, when they think about their baby, they usually have a milk letdown. So focus on your baby and do not watch the bottle. Some women have the habit, especially when they're pumping at work, they wait for that 50 ml, 100 ml to get over. Do not watch the bottle when you pump the milk. Stock up breast pads. Like I told you, there could be accidents. You could have a milk letdown at work. So it is always wise to stock up breast pads and carry extra clothes to prevent any embarrassments, and dress for comfort. These days we have lovely designer labels who have nursing wear, and it is also important that you actually carry a nursing apron when you're moving around, because you could just snuggle the baby between your nursing apron and your breasts, and it is, I mean, you can feed anywhere and everywhere. All you have to do is just cover yourself with an apron. Ask for logistical support. For example, if your husband is on a different shift, you could probably ask him to bring the baby maybe once a day to your workplace, and the next hour could be a pumped milk. So ask for logistical support. When you're at home, only breastfeed the child, avoid pumping. Now this is very important because you have to sustain the milk production. If you continue to pump even at home, then your milk secretion will definitely come down. Bond well with the baby. Nourish yourself. I think this Shiny will speak about it. And it's important to be hydrated. Hydration is the key for breastfeeding. Try to hydrate as much as you can. It takes a village to raise a child. I would say even more, because I have two handful boys. So take as much as support you can. Sahitya had mentioned about the breastfeeding groups and all that. So seek the help of your spouse, seek the help of your family, your friends, your colleagues, even your employer. And if there are peer-friendly mom groups, please take their help.
Ready, Mark? Ready.
Hi everyone, my name is Sahitya Chakanathan. I'm a twin mom. I also do a lot of other things in entertainment. I'm here at the Bhalakh Medical Center for their breastfeeding awareness program, and it's really exciting like something like this is happening, because breastfeeding rates are dipping to alarming rates in the country, and I think we need to have more awareness programs for mothers to be educated, mothers to be supported, mothers to be cheer-led on, because honestly breastfeeding needs to be like an Olympic sport, because that's what it feels like, especially as a twin mom. So it's nice to have breastfeeding friendly pediatricians come up here, suggestions on diet to follow, lactation consultants giving you advice, and more importantly have other moms talk about challenges that they face, because most moms usually feel alone, especially first time moms. They feel maybe I'm doing something wrong. It's important to know you're not. It's a learning curve, and there are other moms who struggle as well, and it's very, very important to ask for help, especially from experts, not random aunties and uncles who have opinions, but experts in the field who will be there to support you on your journey.
நீங்க எந்த மாதிரி காம்ப்ளிமெண்ட்ஸ்லாம் நடந்தவங்க கேட்ட குயின்ஸ் குழந்தைங்க எப்படி நீங்க சமாளிச்சீங்க?
எப்படி சமாளிச்சிங்கன்னு கேட்டிங்கன்னா, நல்ல வேளை என்னோட my first children were twins. If I had a single one and then twins, it would have been twice as difficult, but my normal is 2 babies. But I'll start again, right? So I faced a lot of challenges. Initially it was very, very easy, but sometime around 2.5 months, wherein a lot of symptoms for what is known as cow's milk protein intolerance, which is not something a lot of people know about. A lot of people aren't very aware of it. It's something I had to do a lot of research and learn about. But as soon as I did that and I eliminated dairy from my diet, a lot of the problems that my children facing went away, and they went to being happy children. But as new mothers, I think the thing that you hear as soon as your baby cries, it's colic, or you're doing something wrong, or like your milk is not enough. I think that phrase needs to be deleted from the dictionary. Only medical professionals and lactation consultants and like breastfeeding friendly supportive doctors who can medically diagnose you are allowed to say that. Not like family and relatives and the rest of the world. As soon as a baby cries, a baby can look skinny. I have twins. One of them is skinny and one of them is chubby. And they both get the exact same nutrition. So there is no saying what makes a baby look a certain way. and whether the baby's tummy is puffy or how much the baby is crying, all of these are old wives' tales. None of it tells you whether the baby's had enough milk or not. It's only the number of wet diapers and the weight gain. So please, trust the doctor, trust your instincts.
Thank you so much.
இது வந்து தாய்ப்பால் அவேர்னஸ் வீக் வந்து இந்த ஃபஸ்ட்டு வீக் ஆஃப் ஆகஸ்ட் யூஸ்வலாக. அது வந்து தாய்ப்பாலை விட சிறந்தது உலகத்தில் ஒன்றுமே கிடையாது. இது வந்து லிக்விட் கோல்டு அப்படின்னு சொல்கிறது, தங்கத்தை விட உயர்ந்த ரொம்ப முக்கியமானது. ஸோ எல்லா தாய்களும் வந்து முதல்ல குழந்தை பிறந்ததுலேருந்து பிறக்கிறதுக்கு முன்னாடியே வந்து ப்ரிப்பேர் பண்ணணும். எப்படி வந்து பால் கொடுக்கறது, என்ன சாப்பாட்டு சாப்பிட்டா நல்லது குழந்தைக்கு பால் வரத்துக்கு. குழந்தை பிறந்த அரை மணி நேரத்துலேயே வந்து தாய்ப்பால் கொடுக்க ஆரம்பிக்கணும். அண்ட் அப்பப்போ எவ்ரி ஒன்றரை மணி நேரத்துக்கு 2 மணி நேரத்துக்கு ஒரு தடவை குழந்தை அழும்போதெல்லாம் பால் கொடுக்கணும். தாய்ப்பாலை விட சிறந்தது ஒன்றுமே கிடையாது. அவங்க வந்து கொஞ்சம் கஷ்டம் ஏதாவது இருந்ததுன்னா அவங்களோட பீடியாட்ரிஷியன் இல்லை கைனகாலஜிஸ்ட் இல்லை லாக்டேஷன் பற்றி சொல்லி கொடுக்குறவங்க நிறைய பேர் இருக்காங்க. இவங்கள அணுகி வந்து எப்படி எந்த விதத்தில் வந்து குழந்தைய பிடிச்சிக்கணும், எப்படி வந்து அது கரெக்டாக அந்த லேச்சிங் இருக்குது, இதெல்லாம் கற்றுண்டு வந்து தாய்ப்பால் கொடுக்கணும். இதில் வந்து அந்த குழந்தைக்கும் ரொம்ப நல்லது. ஏன்னா கரெக்ட் அமௌண்ட் ஆஃப் ப்ரோட்டீன், வைட்டமின்ஸு, கார்போஹைட்ரேட்ஸ் எல்லாம் குழந்தைகளுக்கு கிடைக்கிறது. இதை தவிர அந்த தாய்க்கு வந்து பிற்காலத்தில் பிரெஸ்ட் கேன்சர் இல்லை வந்து ஓவேரியன் கேன்சர் இதெல்லாம் வந்து தடுக்கிறது. அவங்களோட உடம்பும் வந்து நல்லா இருக்குது. ப்ளஸ் அவங்க மனநிலை, உடம்பு, ஃபிசிக்கல் மென்டல் ஹெல்த் ரெண்டுத்துக்கும் வந்து தாய்ப்பால் ரொம்ப சிறந்தது. ஸோ இந்த விழிப்புணர்வு வந்து ரொம்ப முக்கியம் எல்லா இடத்துலையும், தட் இஸ் பப்ளிக்குக்கும். ஸோ எல்லா இடத்துலையும் வந்து தாய் சேய்க்கு வந்து ஒரு இடம் வகுத்து வைக்கணும் தாய் ஃபீட் பண்ணுறதுக்கு. ஸோ கண்டிப்பாக வந்து 6 மாதங்களுக்கு வேறு எந்த உணவும் கொடுக்காம தாய்ப்பால் மட்டுமே கொடுக்கணும். தண்ணி கூட கொடுக்கக்கூடாது. 6 மாதங்களுக்கு பிறகு பாக்கி உணவுகளோடு சேர்த்து தாய்ப்பாலையும் தொடர்ந்து ஃபீட் பண்ணணும். 2 வயசு வரைக்கும் கொடுத்தா நல்லது. அந்த குழந்தையோட ஃபிசிக்கல் க்ரோத், தட் இஸ் உடம்போட வளர்ச்சி, மன வளர்ச்சி, இந்த மைல் ஸ்டோன்ஸு, காக்னிஷன்னு சொல்கிறது, மூளையோட வளர்ச்சி. இப்போ எல்லா மதர்ஸ்களுக்கும் தங்களோட குழந்தைய தான் வந்து பெஸ்ட்டாக இருக்கணும்னு எதிர்பார்க்குறாங்க. ஸோ இதெல்லாம் வந்து தாய்ப்பால் கொடுக்கறதுனால தான் வருது. இப்போ என்ன ஆகிறதுனா, எல்லோரும் வந்து வேலைக்கு போகிறதுனால வந்து குழந்தைய வீட்டில் விட்டுட்டு போகிறதுனால எப்படி அதை ஃபீட் பண்ணுறதுங்கிறது ஒரு பெரிய கவலை அவங்களுக்கு. அதனால் வந்து இது பம்ப் பண்ணி ஸ்டோர் பண்ணி அவங்க வீட்டில் யாராவது அந்த தாய்ப்பாலை கொடுக்கலாம். இல்லை வந்து இப்போ பெய்ட் லீவ் கூட இருக்குது. ஒரு 6 மாதங்களுக்கு வந்து நிறையா ஆர்கனைசேஷன்ஸில் தாய் சேய்க்கு வந்து ரொம்ப ஆதரவாக நிறையா புது ரூல்ஸ்லாம் இருக்குது. அதனால் அதையும் வந்து யூஸ் பண்ணிக்கலாம். மற்றபடி வந்து வீட்டில் வந்து தாய்ப்பாலை ஸ்டோர் பண்ணிவிட்டு அதை வந்து மெதுவாக வார்ம் பண்ணி, தட் இஸ் தண்ணீரில் வச்சு சூடு பண்ணக்கூடாது ஸ்டவ்வில், பட் அதை ரூம் டெம்பரேச்சருக்கு கொண்டு கொடுக்கலாம். என் பேர் வந்து டாக்டர் பிரியா பிஸ்வகுமார். நான் பீடியாட்ரிஷியன், இந்திரா சைல்ட் கேரும், அப்போலோ சில்ட்ரன்ஸ் ஹாஸ்பிட்டல்.
Hi, we are here today to build awareness around breastfeeding, and we are at the Bhalakh Medical Center. I'm a guest speaker and I'm really glad to be here. I'm talking today about empowering women to pump and store milk in order to return to work in the postpartum. And this is a very important topic because a lot of times, because of misinformation or lack of the right kind of guidance, women feel like they need to stop breastfeeding, or they might try to troubleshoot on their own and figure out a way around it, and they may not be very successful, or they may end up with other issues that might cause difficulties with moving forward with their breastfeeding journey. So it is our goal here today to empower women to form a village, a support system that helps them stay on the right track, that helps them feel like they are satisfying their breastfeeding goals. And it's very important to support them in what their goals are and meet them where they are with this. So that's our goal today, and I'm hoping that this awareness campaign is going to help a lot of women out.